We are going to talk about this topic, which is very important. As you know, we want to improve our patient health, and in order to improve it, we need to find gaps. Where are gaps that we can improve so that patient can be in good way taken care of, and the outcome will be better as well. So by the end of this presentation, the aim is to all the participants should be able to know what is clinical audit, to know what is the benefits of a clinical audit, and how you can conduct a clinical audit. And let's start with the first point. We'll spend more time on the third one because that's where really we are in our practices. That's why we are going to spend more time on the third point. But quickly, what is clinical audit? Clinical audit, as you can see, that's a method used by health professionals to assess, evaluate, and improve the care of patients that we are taking care of, but not the word systematic. It is done in the systematic way, and for objective, it is health quality should be improved. And in another way of defining it, it is looking at your own practice. So where we are practicing, we are at the hospital, we are at the health centers. You ask yourself question like, what should we be doing? You are asking, are we doing the things rightly? Like another one paraphrased it and say, are we singing this song right? We are with women, we are with kids, we are with education, but are we doing these things rightly? Are we doing it? If not, where and how can we improve? And this audit is part of clinical governance. Quickly, clinical governance is to improve the standards of care. In some areas, some part of the world, in some countries, the governance has got 7 pillars, which is clinical audit, clinical effectiveness, risk management, use of information, education and training, staffing, human resources, and then the patient. We should not forget the patient. So the audit is part of these 7 pillars of clinical governance. So you assess if healthcare is okay, but against standard. Don't do it anyhow, but you assess it against standard. And this led to provide to know where are we now, and how are we going to improve it? Because the aim is to improve the outcome of patients. The aim is to improve also the quality of care that we are giving to our patients. In summary, the definition can be: look at your own practice in a systematic way with a standard, but you don't do it alone. It is a multidisciplinary work. You cannot do it alone. So, after talking about what it is, but what is not audit, because usually people, they confuse easily audit to other things, and most importantly, people confuse reviews to audit. Clinical audit is not reviews. It's not reviews. Reviews are some case discussion that we always have in our ward, in our hospitals, discussion on maternal death or near misses, the morning report handovers that we do, or the monthly maternity or perinatal mortality that we have every year. In some department, they have those meetings. They are not audit. So don't confuse that. Another way also to say that it is not a witch hunt. People think that when there's an audit team coming, they are thinking that they are witch hunting some person because someone is not doing its job. Then they design this audit. No, it is not witch hunting. Audit is also not just data collection. People just say, okay, because we were not collecting data here, so let's start collecting it. They think that is audit. It is not. It is also not a cost-cutting experience. Don't think that when you are doing your audit, it will be just a cost-cutting. It is not a piece of research. We are going to see shortly the difference between audit, research, and quality improvements. It is not a computer crunching exercise that we are going to enter all the numbers, all the action in the computer, and you think that is audit. No, audit is not like that. So there is a difference between QI, quality improvement, clinical audit, and research, which we should know. Research or quality improvement and audit, they are different, and they depend on purpose. What is the purpose of a research? It's you generate new knowledge. You want to discover a new thing. The quality improvement, you want to improve healthcare processes. For this patient to go out home very well, what are the processes that we are doing and we are doing well? What are the processes we are doing wrong? And what is the outcome? While the audit is assessing the compliance and identify gaps, which will now help us to start our quality improvement project. In methodology, research is just a systematic data collection, while QI are interactive cycles, which also has some data collection. While the audit, for the audit, you examine the existing data, or you examining the existing processes when how we are working. In the outcome, as I said, research, you get a new knowledge, while for the QI, you improve the process and you improve the outcome. And for the audit, you are going to assess the compliance. The time frame for researchers can take even years, 10 years, 3 years, something like that. While quality improvement is few weeks to month. For the audit is very, very short duration of audit period. But every process also include ethical consideration for privacy of patient, informed consent for research, patient safety and ethical consideration for QI, and patient privacy, confidentiality for audit. And something about the audit for the ethical, we need to know that for the audit to need someone to go to the research board to have the authorization. It is said that you need approval if audit involves anything being done with patients which would not otherwise be part of their routine management. I'll give an example. If they are suspecting that patients are being given wrong medication, so how will you know that is a wrong medication? It is maybe to take some of the blood to go and verify what is in the composition in the sample of the blood. That will require that you go for ethical approval. Okay, the other one is collaboration. In every step, every type you collaborate. For the dissemination, you also have to disseminate what you do. For research, publication, presentation, conferences, sharing with the organization for the improvement QI, and the finding for the audit will inform those people doing the QI about the gaps that were found, so that they can start now their QI, and you can also publish what you've already found. So that's about the definition, and you can get it anywhere in the books. The benefits of audit. Why should you do a clinical audit? It is to reduce errors, improve efficiency of effectiveness, demonstrating good care, and you meet patients' needs and expectations. Patients, when they come to hospital, they want to be healed and when go back home very well and in good health. So you are going to meet their expectation by doing clinical audits. Also, you stimulate education, because if you find a gaps and that gap will need that people need to have a CPD on that subject. The audit will stimulate for us to have that. It will also help to bid for resources. If, for example, what you've already done, you found something that will need a project that will need funding, like there is no ultrasound machine in the department, and that's why patients, they are having a lot of prematurity. Okay, you will need to prove that with data that you got from an audit, for example. It's just an example. It can be also an effective defense. I can give here an example. You have some issue in the department, in your ward, and they ask for a neutral person to come and verify what happened, and he will come to do the audit. That audit will find out, no, this patient was well managed with no problem. They followed the standard, so it can be now used as a defense. According to the standard, they followed all the management. They can also identify and promote good practice, lead improvement, provide information about the effectiveness of the service. We hear some people, they say, my hospital is the best. Is the best on what? But if we have audit being done and you have the report, that one will be one of the factors that will help people to say, yes, this hospital is okay. Okay, the audit also, why you do audit is to improve staff morale. If they do that, the department, this ward, the gyne ward work very well, because you've already found that we did the audit to find out all the patients are satisfied there. So the more people will be having a good morale, they will be well motivated because of the work that has been proved that it is very well according to standards. So improvement of staff morale is also looking at the system. You look at your environment. Is the environment able to provide really safe and good treatment? It's also highlight the problem. As I said, it will help to pick some gaps, and those gaps will help to highlight the problem that are there, and then we look for solution to improve it. Improve teams working. As I said, you don't do audit alone, you do it with other people. So it will improve communication where there's communication problem, but with audit, it will improve that. It gives staff also a systematic way of looking at their own practice. Now let's go to how it is done. Everyone should know that the way to be sure that you are doing audit, this should be known that you are looking at standard. When you are doing audit, look at evidence-based standard. The standard is also called criteria or indicators. That's why you hear the word, I think you've heard this word called the CBA, criteria-based audits. It's because the standard we are looking for, their criteria. Those criteria, they compare. Now you compare the current practice, what we are doing now, to those standards. Okay, and it is done in cyclical pattern. It's a cycle that you're going to do, and this is an example of a cycle. So you start by what should be happening here in my ward, in my health center, in my hospital, in my department, and you now look at what is happening now. What is happening? All right. Then you say, when you know what is happening, you find out there are some gaps. Okay, those gaps will need you to do changes. The change idea will come from there, and you now change what you found. After you've changed, you need to redo the cycle and say, okay, what is happening now? We did those changes. What is happening? So the cycle continue like that. In another way, we can say that you select a topic of your audit. That answer the question, what should be happening here. So you select the topic of that audit. You observe the current practice, what is happening, all right? Then you compare that practice to your standard or the guideline, all right? And you find the gaps, then the gaps, you implement the changes with the QI project now, and after the QI project, you will redo the audit, find out that everything is doing well or not. Another way of representing it, that way we are going to go quickly in all the phases. So the first thing, as I said, look for a topic of your audit. What makes a good audit topic? A good topic, when you choose a topic, it can be a problem of national importance. It can be a local concern. I put there an example of maybe we are concerned that there are too many C-section here. There are too many SSI here. There are a concern about the use of magnesium sulfate in the maternity. So most of the example I'll give here, they are in obs and gyn, but you can take any other department to consider those questions. It should be also known that the topic can be something that the patient are concerned about. Like patients are concerned that to see a doctor here, an intern in maternity, it takes too much time. So they are concerned. So you can do an audit about that. Audit all the patients who arrived to find out how many minutes it took for an intern to come, something like that. Okay? Or it can be a significant event. The topic should be showing that there's a significant event happening in the department, in the ward, okay? Or it can be a new treatment. They are starting this magpie or another new treatment, but you don't know how people are doing it. So you do an audit to find out if it's well done, okay? It can be management issue. How are we managing our patients? It can be something that matters financially, okay? Because these things cost too much. We need to know if people are using it correctly. Otherwise, it will be waste of money, all right? It can be also just an observation. We've observed that VE, vaginal examination, is done only once in women, who are in labor ward. Why? So you go and observe that one. It can be also something that is doable. Select a topic that is doable. Select a topic that is achievable. Select a topic that can improve the quality of patient. That's a good topic. If it is your topic is not relevant to those areas, then it is not a good topic. You need to choose another one. All right? And you should know that it is not done in solo. You do it with the team, but you don't look someone else practice. I'm here in Queens. I'm going to look at limb-based services. No, that won't help. But if you want to do that, then involve them, okay? Someone from Limbe, from Lilongwe, you want to come and do an audit here in Blantyre. No, it doesn't work like that. So if you want, then involve the people that are around there so that you can do the audit together. Now, that was the topic. Once you have the topic, find your evidence. The evidence, those are the standard, all right? The standard, where do you get them? What is the sources of the standard? Usually, you are going to work hard to do a literature review to find those standards. And there you can see a long list of where you can find the standard in electronic database, national guidelines. But if you don't have all those, the topic doesn't have any guideline, you can use local consensus. But here we say, be careful, be careful, because that is not a proven best practice. You don't select also something because that's the way we are doing it. No. That is not the way of looking for evidence. So you have now the evidence, you've checked your standard, your guideline on that topic. So now establish the baseline. What is the baseline that we are going to follow for that? So for the baseline, use a broad topic, like there I said, use C-section. And you break that big topic, and you do now specific objective in that C-section, because you can study, you can do audits, a lot of audit in just C-section. So you use first a broad topic, and then you'll do it, you'll have small objective. After you have your big topic, select your criteria. All right? Now, as I said, the criteria should be measurable. Okay? You want to do a statement saying that what should be happening according to that topic of yours. I put there an example as saying decision to incision time for C-section, for example. The decision, you took the decision to do a C-section, and how many minutes, how much time it take to do the skin incision. So decision to incision time should be, so that is a criteria that you are making. And in addition to that, you should have what you can, it's called boundary. There should be a boundary on that topic. It's also called yardstick, boundary. Then set your target. Your target is in terms of percentage. Okay? Usually the target, it should be 100%, because all the patients should be taken care the same way. All right? But you can use lower number because of some issues that you have, or there is a national target, or there's a baseline audit that was done before, and you found that this was the percentage that people were having. So you are choosing that one as a target. But you usually set your target to 100%. All right? When you are doing that, there are some exceptions, all right? Exceptions are clinical reason why the standards that you've chosen are difficult to be met. For example, if you are looking at an audit of pathograph, and you have patient with elective C-section, all right? Elective C-section with previous scar. They just come because they have previous scar, so they don't go into labor. Those one, you are not going to study their pathograph, okay? So that one, it will be an exception. All right? So let's give you some example. Standard equals criteria plus target. All right? So we are going to get a standard which is a statement of what to be measured. All right, plus a yardstick. A yardstick, we said, is a boundary. This statement should be within what? You see the example shortly. Then you set the target, which is a percentage to be achieved. An example of audit standard: 100% of patients operated at operating theater will have their surgical safety checklist filled before, during, and after the operation. All right. So in red, that is the target, 100%. In green, that's the criteria. You want that patient operated at this maternity should have their surgical checklist filled. That is the criteria. All right. Now, what is the measurement boundary? It is before, during, after the operation. That is the yardstick. So if I can ask maybe during the discussion, what are the exceptions for this example? Second example: 95% of PPH referrals are referred appropriately according to the Blantyre Health District guideline. All right, that's another standard that you are auditing. Any exception, you can look at it. Another example here: 100% of patients indicated for C-section will have their C-section start within 30 minutes of decision. All right, 100% is the target. What is the criteria? Patient indicated for C-section will have their C-section start. Boundary within 30 seconds. All right, 30 minutes, sorry. Another example, 90% of patients requiring urgent attention, or meaning that who have complication, should be seen by registrars within 30 minutes of being called. So you can do exercises after this this talk. You'll do exercises to do that. So the green is criteria, the target is red, and the yardstick or the measurement boundary in blue. So make sure that your standard that you are auditing follow that way. And as you've seen, it is SMART, so it is specific, measurable, achievable, relevant, and in time scale or theoretically sound. And the example are there, but we are going to do to go quickly. Audit can be part of an evaluation. All right, you have done some evaluation, some mock evaluation in the past, and we were having some specific topic to audit. For example, there we have magnesium use, we have also pathogram use, or the bundle for PPS use. So those are the examples that you can follow. So it is also part of an evaluation. We said the definition is to assess, to evaluate, and to examine your own practice, how it is. So an evaluation, during an evaluation of a mock services, we can do also audits of one part. All right, so you have now your standard, your topic, you had it, your criteria, you gave it, you have the target. Now do it now. Start doing it. Well, so you'll do what we call the design. You design your audit. This is now paperwork. You are going to do right, whether it will be a retrospective, prospective, who is the target population, what data you'll collect, where, who, how, and how much or how many, how long, what time, what resources do you need. So you are designing now your audit like that. Let's talk about the collection in that design. The collection of data, you should have a simple form. Don't have a complicated form. It's not a research. You just have a simple form, but pilot it before you start. At make sure that you are respecting privacy, anonymize all personal data. The source of data for the hospital and health centers is patient record, the activity data record, or survey, questionnaire, or interviews. And after you've done your data collection, then you analyze your data. Your analysis will help you now to say what is being done here. You have your results, but make sure that when you are doing that, don't use complicated statistics. We've just finished a QI training 1 week ago, where we were told that for the best way of the good statistics measure that you can have is the median than the mean, because the mean is being affected by those outliers. So in your the next time when you do an audit, make sure that when you are doing your statistics, look more on the median than the means. Okay. So, and after you've done, because you'll do it maybe twice or 3 times, you can also compare now before you did it and after you've done it, to see whether the difference was significant or not. So the result have shown you the gaps. So once you have the gaps, the QI team will take over so that they can make change now. That is the QI, and you have your report, go and present it to your people. If you have completed all the standard were met, then brilliant. tell the world about it, that here in this hospital we do really very well. If not, then if you did not meet the standard, you had gaps, that's when you need to look for the possible causes and solution. As I said, that's where the QI steps will stick in. The fishbone, the diagram, the driver diagram, for those who are dealing with QI, they know all this one, and then an action plan will come from there. So you've done this, complete now the cycle, and you can now re-audit and see if the changes that you've made are being implemented. Don't re-audit until you have made changes. You've done an audit, but no changes have done. Then someone else come and do the same audit. No, that will not help you much. Do the re-audit only if you've implemented changes. Then after the change I've done, do another loop. And it said just 2 loops are enough. So key point is that choose your topic based on the point that I highlighted earlier, and find good standards of good quality, and also remember all the stages, the steps that I've said, and use action points. Repeat the audit to find whether there is improvement or not. If you are not changing or improving things as a result of an audit, then ask yourself, why am I doing this? It's a good statement. Why am I doing it? You are doing audit, but then nothing's being changed. Why are you doing it? Just rethink again that audit, or just consult again so that we have improvements. Thank you so much for your attention. Zikomo, merci and asante sana.